In this part of the course, you learn about injury emergencies. This includes external and internal bleeding. Bleeding can quickly become life-threatening if not controlled. Severe bleeding occurs when a large blood vessel is cut or torn. When this happens, a person can lose a lot of blood within minutes. Minor bleeding occurs from small cuts or scrapes. Most bleeding can be stopped with pressure. It's important to stay calm. Bleeding often looks worse than it is. Let's go to a scene where a store employee was cut by broken glass. Watch closely how another employee used her first aid training to stop the bleeding.
Ah! Lisa! I need your help!
Tom, are you alright?
I cut myself.
Sam, can you clean this up before someone else gets hurt? Let me see your arm. What happened?
I just grabbed the frame and tried to put it on the wall and it just slipped from my hands.
Alright, it's alright. Remember, I took that first aid course. Let's go over to this counter.
Okay.
I'm gonna get the first aid kit. Put this gauze on the cut and press down while I get my gloves on.
Okay. I would have never thought this would happen to me.
It's alright, things like this happen. I'm gonna try to get the bleeding to stop, but I'm gonna have to press down hard, okay?
Okay.
Okay, it's bleeding through, so I'm gonna add some more gauze.
Can you take the old one off?
No, it might pull out some clots and make the bleeding worse. I'm gonna push down a little harder with this extra gauze, and I think we can get the bleeding to stop with a little more time and pressure.
Okay.
Okay, looks like the bleeding has stopped. Let's get a bandage on it. There you go.
Thanks.
Lisa is able to stop Tom's arm from bleeding with direct pressure and the use of dressings and bandaging. Let's talk about the difference between a dressing and a bandage so that you can understand how they work together. A dressing is a clean material used directly on a wound to stop bleeding. It can be a piece of gauze or any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a bandage. To stop external bleeding, take the following first aid actions. First, make sure the scene is safe for you and the injured person. Send someone to get the first aid kit. Put on personal protective equipment. If possible, have the person apply direct pressure. Apply dressings from the first aid kit and put direct pressure on the dressings over the bleeding area. Use the flat part of your fingers or the palm of your hand. If the bleeding doesn't stop, you'll need to add a second dressing and press harder. Do not remove a dressing once it's in place, because this could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. Once the bleeding is stopped, or if you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. For minor cuts, wash the area with soap and water, and then apply a dressing to the wound. Now, we'll show you a demonstration of the steps for stopping external bleeding. You'll practice what you learn afterward, so pay close attention. First, make sure the scene is safe for you and the injured person. If appropriate, have someone phone 911 and get the first aid kit and AED. Put a dressing on the wound. Apply direct pressure on the dressing. Use the flat part of your fingers or the palm of your hand. If the injured person is able to do so, ask him to hold gauze to the wound and apply pressure while you put on protective gloves. Then, let him know you will take over. If the bleeding does not stop, apply more dressings on top of the first and press harder. Keep pressure on the wound until it stops bleeding. Do not remove any gauze once it's in place. After you have used direct pressure and dressings to stop the bleeding, apply the bandage over the dressings to keep pressure on the injury, protect it, and secure the dressings. The video will now pause for you to practice stopping bleeding and using dressings and bandages. Pair up with a partner and take turns being the injured person and rescuer. Your instructor will test your skills after you get a chance to practice. You've just practiced the steps for controlling bleeding and bandaging. But what if the cut is much deeper, and after you've applied pressure and dressings, the bleeding doesn't stop? Let's go back to the store and see what happens if the situation were much worse. Tom has a much deeper cut, and applying direct pressure isn't enough to stop the bleeding.
Tom, are you all right?
I cut myself.
Sam, can you clean this up before someone else gets hurt?
Yeah, I got it.
Let me see your arm. What happened?
I grabbed the frame, tried to put it on the wall, and it just slipped from my hands.
It's all right. Remember, I took that first aid course. Come on, let's go over to the counter. That looks pretty deep. Here. Put this on it and press down hard while I'm calling 911.
911, what's your emergency?
It's my coworker. He cut his arm on some glass at the store, and it looks pretty bad.
What's your address?
It's 6977 Rose Street, the antique store.
Okay, 6977 Rose Street, the antique store. I've dispatched paramedics. Is he conscious?
Yeah, he's conscious.
And where is he bleeding? Have you tried to stop it?
It's his arm, his left forearm. I'm trying to stop it now. I'm using some gauze and pressing down really hard, but it's not stopping.
Do you have a tourniquet?
Yes, there's one in the first aid kit.
Go ahead and use it, and put it about 2 inches above the cut.
Apply pressure while I get the tourniquet. Okay, I'm going to put this tourniquet on your arm to try to get the bleeding to stop, okay? Hang in there with me.
Okay. Oh, that's tight.
Yeah, but I think it's working.
I'll note the time is 2:30. Please write that on the tourniquet. I share the paramedics are almost there.
Sam, can you meet the paramedics outside and let them in? Thanks.
Lisa tried to stop the bleeding using direct pressure, but the cut was deeper than originally thought, and applying pressure didn't stop the bleeding. When this happens, use a tourniquet. The first aid kit should contain a pre-made or manufactured tourniquet. It includes a strap that you wrap around the injured person's arm or leg and a straight, stick-like object called a windlass. The windlass is used to tighten the tourniquet. If applied correctly, a tourniquet should stop the bleeding. If you don't have a tourniquet, you can make one. Fold a cloth or bandage so that it's long and at least 1 inch wide. Wrap the bandage 2 inches above the injury if possible. Tie the ends of the bandage around a small hand tool, stick, or something similar. Turn the item to tighten the tourniquet. Continue tightening until the bleeding stops. Secure the hand tool or stick so the tourniquet stays tight. Note what time the tourniquet was placed. To summarize, take the following actions when using a tourniquet. First, make sure the scene is safe for you and the injured person. Phone 911 and get the first aid kit and an AED. Wear personal protective equipment. Place the tourniquet about 2 inches above the injury if possible. Tighten the tourniquet until the bleeding stops. Note what time the tourniquet was placed on the body. Once you have the tourniquet in place and the bleeding has stopped, leave it alone until someone with more advanced training arrives and takes over. the loss of a lot of blood can lead to shock. Besides loss of blood, shock can be caused by a heart attack or severe allergic reaction, among other things. At our store, if a tourniquet was not available, it could lead to a significant loss of blood, and the person could go into shock. A person in shock may feel weak, faint, or dizzy, feel nauseated or thirsty, have pale or grayish skin, be restless, agitated, or confused, or be cold and clammy to the touch. First aid actions for shock are: make sure the scene is safe, phone 911, and get the first aid kit and AED if available. Help the person lie on his back. Cover the person with a blanket to keep him warm. Check to see if CPR is needed. If so, provide CPR.
All right, let's hustle out there.
Have you ever had a nosebleed? Maybe from blowing your nose too hard? Or how about from getting hit in the nose with a ball?
Okay, you're going in next. I want to see what you can do.
Coach, sorry, Coach.
Hey, Bobby tipped it. The ball just came your way. Need some help?
Yeah, I need some help.
Hey, Angelo, go get the first aid kit from the gym office. No, lean your head forward.
I thought I was supposed to hold my head back.
No. You don't want to lean your head back when you're trying to stop a nosebleed. Okay. I'm going to pinch your nose pretty hard with this gauze. Maybe for several minutes.
Okay, I'm ready.
To stop a nosebleed, apply pressure and follow these first aid steps. As with other bleeding emergencies, first make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Have the person sit and lean forward. Pinch the soft part of the nose on both sides with a clean dressing. Place constant pressure on the nostrils for a few minutes until the bleeding stops. If bleeding continues, press harder. Phone 911 if you can't stop the bleeding in about 15 minutes, if the bleeding is heavy, such as gushing blood, or if the injured person has trouble breathing. Sometimes, when a person suffers a mouth injury, one or more teeth may have broken, become loose, or been knocked out. This can be a choking hazard. As with other emergencies we've discussed, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment. Then, follow these first aid actions that are specific to tooth injuries. Check the person's mouth for any missing or loose teeth or parts of teeth. If a tooth is chipped, gently clean the injured area and call a dentist. If a tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place and call a dentist. If a tooth has come out, it may be possible for a dentist to reattach the tooth. So when you hold it by the crown, the top part of the tooth, not the root. Apply pressure with gauze to stop any bleeding in the empty tooth socket. Clean the area where the tooth was located with saline or clean water. Put the tooth in one of the following: egg white, coconut water, or whole milk. If none of these is available, store the tooth in the injured person's saliva, not in the mouth. Immediately take the injured person and tooth to a dentist or emergency department. Eye injuries are fairly common when it comes to providing first aid. Any direct hit, such as a punch to the eye or chemical in the eye, can create big problems. If the eye is hit hard or punctured, phone 911 and tell the person to keep both eyes closed. If something small like sand gets in a person's eye, rinse with lots of running water. Phone 911 if the sand or object doesn't come out, if the person complains about extreme pain, or if the person still has trouble seeing. Tell the person to keep his eyes closed until someone with more advanced training takes over. If chemicals get in a person's eyes, also rinse with lots of water. Rinse for at least 15 minutes or until advanced medical care arrives. If an eye wash station is nearby, or you have access to an eye wash kit, use it. If neither is available, use water from the tap or normal saline or contact lens solution and phone 911. If only one eye is affected, Make sure the eye with the chemicals in it is the lower eye as you rinse. Try not to rinse the chemicals into the unaffected eye. Penetrating and puncturing injuries to the body are treated differently from more common bleeding injuries. An object such as a knife, nail, or sharp stick can wound a person by penetrating the body or puncturing the skin. If the object is stuck in the body, leave it there until a healthcare provider can treat the injury. Taking it out may cause more bleeding and damage. Follow these first aid steps for penetrating and puncturing injuries. First, make sure the scene is safe. Try to keep the injured person from moving. Get the first aid kit and AED. Wear personal protective equipment. Phone 911 and try to stop any bleeding you can see. One external bleeding injury that may seem overwhelming is traumatic amputation. Amputation occurs when any part of an arm or leg is cut or torn off. It may be possible to reattach amputated fingers or toes. And because of this, it's important to know first aid actions to first stop bleeding by using pressure and possibly a tourniquet, and then to protect the amputated part.
It looks like the bleeding has stopped. Austin, keep holding your hand like we told you to. I'm sorry. I know it hurts. I'm going to put you on speaker mode so you can tell us what to do.
Okay. First, get your plastic bags that you can seal and put ice in one of the bags.
Okay, I'll get the bags and ice.
Okay, we've got the bags and we've got the ice. Now what do we do?
You need to rinse the finger off in water and then cover it with clean dressing from the first aid kit.
Okay, just kind of wrap it?
Yes, and then place the finger in an empty plastic bag and seal it.
Okay.
Austin, I know you're hurting and upset, but it's gonna be okay.
Put a small amount of water in the bag with the ice. Then put the dry bag with the finger in it into the bag with the ice and water. But avoid putting the finger directly on the ice.
Got it.
Label the bag with your son's name, today's date, and the time.
Okay, I've got a marker. I'll do that.
To take care of the amputated part, rinse it in clean water, then cover it with a clean dressing and place it in a watertight plastic bag. Place the bag in another container with ice or ice and water, and label it with the injured person's name, the date, and the time. Make sure the body part gets to the hospital with the injured person. Remember, do not place the amputated body part directly on ice, because extreme cold can injure it. We've seen examples of external bleeding, from severe cuts to nosebleeds. But what about internal bleeding? Bleeding that you can't see. Internal bleeding is bleeding inside the body. When bleeding occurs inside the body, you may be able to see a bruise under the skin, or you may not see any signs at all. You won't be able to tell how much bleeding has occurred. Suspect internal bleeding if a person has an injury from a car crash, being hit by a car, or falling from a height. An injury in the abdomen or chest, including bruises such as seatbelt marks, sports injuries, such as slamming into other people or being hit with a ball, pain in the abdomen or chest after an injury, shortness of breath after an injury, coughed up or vomited blood after an injury, signs of shock without external bleeding, or a knife or gunshot wound. If you suspect internal bleeding, follow these first aid action steps. Make sure the scene is safe. Get the first aid kit and AED. Wear personal protective equipment. Phone 911. Have the person lie down and keep still. Check for signs of shock and provide CPR if needed.
Which trail you boys want to take?
How about the one we did last time? It had some great jumps. Yeah, and let's see who can go 3 times around the fastest.
Now, guys, this isn't a race. Hey! Wait up!
A concussion is one type of head injury. Concussions usually happen because of falls, motor vehicle accidents, and sports injuries. A concussion may occur when the head or the body is hit so hard that the brain is moved inside the skull.
Sam! Boys, stay back. Sam, you okay?
Oh, my head. My head. Oh,
Gosh, you hit your head really hard, man. I don't know what to do. I'm gonna call 911, right?
The possible signs of concussion are feeling stunned or dazed, headache, nausea or vomiting, dizziness, unsteadiness, difficulty in balance, double vision or flashing lights, confusion, and loss of memory of events that happened before or after the injury. With any kind of head, neck, or spine injury, be cautious about moving an injured person. Suspect a head injury if the person fell from a height, was injured by a strong blow to the head, was injured while driving, was in a car crash, or was riding a bicycle or motorbike that was in a crash, especially when not wearing a helmet or the helmet broke in the crash. In addition, a person with a head injury other than a concussion may not respond or only moan, vomit, have trouble seeing, walking, or moving any part of the body, or have a seizure.
Yes, he's conscious. Yes.
If a person has a head injury that results in a change in consciousness, worsening signs or symptoms, or other cause for concern, the person should be evaluated by a healthcare provider or EMS personnel as soon as possible. And phone 911 if the person loses consciousness. A person with these signs should not play sports, drive a car, ride a bike, or work with heavy machinery until a healthcare provider says it's okay to do so. If a person falls, he or she may have injured the spine, which protects the spinal cord. Suspect possible spinal damage if the person is 65 years of age or older, was in a car or bicycle crash, has fallen, has tingling or is weak in the extremities, has pain or tenderness in the neck or back, appears intoxicated or not fully alert, or has other painful injuries, especially of the head or neck. When a person has a spine injury, do not twist or turn the head or neck unless it's necessary to turn the person face up to provide CPR, or you need to move the person out of danger, or if the person is having trouble breathing, is vomiting, or has fluids in their mouth. To summarize, follow these steps when giving first aid for a possible head, neck, or spine injury. First, make sure the scene is safe. Phone 911 and get a first aid kit and AED. Have the person remain as still as possible and wait for someone with more advanced training to arrive.
All right, you guys, bring it on in. Let's finish up some stretching, and then we'll start off with something basic. Maybe some round-offs?
Oh, Coach.
What happened?
I was trying a tumbling pass, and I hadn't warmed up, and I just landed funny.
Well, can I take a look at it?
Yeah,
Okay, where does it hurt?
right here.
All right, you may have sprained your ankle. Sophie, go get the first aid kit. It's in the break room, okay? And Ann, go and get a bag of ice, put a little bit of water in it, grab a towel, okay? It's in the break room, too.
Injuries to bones, joints, and muscles are common, but without an x-ray, it may be impossible to tell whether or not a bone is broken or the injury is a sprain. Either way, you'll take the same first aid actions.
All right, here you go. Careful. All right, now this is probably going to be a little cold, okay?
Okay,
How does that feel?
it's okay. Coach,
Yeah?
what am I gonna do?
Well, you're probably going to have to stay off of it for a little while.
This couldn't happen at a worse time.
I know. Well, this will help with the pain and swelling, okay? Keep this on for 20 minutes, then take it off. No walking on it, and definitely no tumbling until you get this checked out.
Okay.
First, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment. Cover any open wound with a clean dressing. Put a towel on top of the injured body part and place a bag filled with ice and water on top of the towel, over the injured area. Keep the ice in place for up to 20 minutes. Phone 911 if there is a large open wound, the injured body part is abnormally bent, or you're not sure what to do. If it hurts, the person should avoid using the injured body part until checked by a healthcare provider. There are times when someone has a suspected broken bone and you may need to splint it. For example, if you are hiking in the wilderness like these campers, you may need to apply a splint to an injured arm.
Okay, everybody, stay close. We don't want anyone to get lost. This trail has some real twists and turns.
Yeah, we're pretty far out from camp now, but we thought you'd like it.
It's cool. This has been the most fun day.
Ow! Cindy! My arm! Girls, stay back. I don't want anyone else to get hurt. Are you okay? What happened?
I was trying to avoid a hole in the trail and just tumbled over.
Oh, I think it might be broken. I'm gonna need to splint it. Caroline, can you help find some sticks so we can make a splint?
Sure.
A splint keeps an injured body part from moving. If a broken bone has come through the skin or is bent, it shouldn't be straightened. The injury needs to be protected until someone with more advanced training can take over.
Okay. This might hurt a little.